The bill states that all individuals shall have the ability to opt out of any federally mandated, created, or funded electronic system for maintaining healthcare information. In other words, nobody would be forced to be part of a national electronic health record database. And it also requires consent before patients' electronic medical records are shared with others. And it states plainly that physicians and other healthcare providers cannot be forced to use electronic health records if they choose not to. This is important. Some physicians might want to, some may not want to. It really needs to be up to them. And finally, the bill repeals the section of the HIPAA privacy of the HIPAA law that requires everyone to be assigned a unique health identifier, which could be a biometric identifier. And I can talk about that during the Q&A. It's another issue to bring up. Let me just summarize here by stressing that a federal health insurance mandate, as it's being proposed right now, combined with administrative simplification requirements governed by the HIPAA privacy rule, would lead to everyone losing control over the flow of their personal health information and would greatly interfere with the doctor-patient relationship. Trust is a must for quality health care, and all Americans should be free to maintain confidential doctor-patient relationships and relationships with other providers that they choose. Thank you.
Thank you, Sue. Nice job. Very well done. Now, we've already circulated the blue cards. Is that correct? I'm sorry, they're green cards and yellow. Well, if you've got a card of whatever color, we'll take all the colors of the rainbow. Just write your questions down on your cards and pass them to either end. You know, Sue, I was thinking about this privacy issue. And the idea that people might be embarrassed by what's released or might have privacy concerns. They just don't want people to know things. But I really wonder to what degree privacy or the violation of privacy might not be an instrument of political coercion. I noted that on the campaign trail, Joe Wolserberger, Joe the plumber, asked an embarrassing question to candidate Obama. And pretty soon after that, there were leaks to the press about whether he was up to date on child support payments and all the rest of it. I've seen it right down here in the city county building. I've seen friends of mine who were pushed out of office when someone in the bureaucracy didn't like them and would say, oh, 10 years ago he got behind on tax payments, and that stuff got into the newspapers. Imagine if all the healthcare information is in the hands of government, how easy it is to basically discredit somebody, coerce them, kind of crack heads, not literally, but by saying, well, you say something critical of the government, then they're going to know every little bit of your medical history, and that stuff gets leaked to the press. And when something is leaked to the press, it's almost impossible to track it down. So I really wonder whether we're not just talking about embarrassment issues here. We're talking about coercion. We're talking about how government deals with opposition voices. And you can speak to that or not speak to it. I was making a speech rather than asking a question, but I'm mainly filling time while we get these questions. But if you want to say anything about that, feel free to. So, do we have our questions? You're just going to come on up here? Good, I think that makes sense. I failed to make the executive decision to invite you. My apologies. Okay. If health insurance is health care, then is car insurance driving? That's for either.
That sounds like one of those Zen
koans,
koans there.
Right?
Yeah. I think the question speaks for itself.
Aside from changing the balance of power in the next congressional elections, what can we do to undo the damage done to our health care and our country by the current administration?
You want to start? I don't think this thing may be passed into law. That doesn't mean it's ever going to be implemented. and the implementation process, I think, will be impossible. So even if it's passed into law and signed by the president, you saw those quotes that I had up there. Those were all quotes of the governors of those states as they were signing the laws passed in their state. As I said, all of those laws failed. Some of them were never even implemented. Passing a law is one thing, implementing it is something else entirely. The current laws, the current bills in Congress don't anticipate that any of this is going to, other than the taxes, will go into effect until 2013, after the next presidential election. So there's plenty of time to get all this turned around if you stay active and get involved, not just in the lobbying over the passage of a legislation, but in the implementation process. And I think that, frankly, that's when the long knives come out. When the hospitals and the doctors and the insurance companies and the drug companies all start divvying up the pieces of the pie, then is this okay? Should I have it? When they all start divvying up the pieces of the pie to find out how big their piece is, they're all going to just jump all over each other, and I think that it's going to get even uglier than it is today, I think.
Anything?